Hello everyone, my name is Daniela Gill and I am an assistant professor in the Clinical Laboratory Science program here at UTRGV. I will be discussing the Clinical Laboratory Science program, our role in the healthcare team, and how we work together with other healthcare professionals. Medical laboratory scientists are also known as clinical laboratory scientists. We are highly skilled scientists who discover the presence or absence of disease and provide data that helps physicians determine the diagnosis and treatment for the patient. Although we are not often personally involved with patients, such as nurses and doctors, we play a crucial role in the process of providing personalized care. We generate vital important data for identifying and treating cancer, heart disease, liver disease, diabetes, infections, immunological diseases, and many other health conditions. Medical laboratory scientists work in the hospital's laboratories, reference laboratories, state or federal health departments, veterinary clinics, and other fields. When people learn about the CLS program, they ask why we chose this particular profession. Personally, I chose to become a medical laboratory scientist after taking a microbiology course. I was fascinated with how microscopic organisms can cause disease in people. After researching how could I implement my love for microbiology into a career, I discovered the Clinical Laboratory Science program and did not hesitate to apply. Once in the program, I learned about the other core duties a medical laboratory scientist performs in addition to microbiology. One of them is hematology, which is the study of blood. Here we learn the different blood type cells and their role in our bodies and what occurs when there's a deficiency or presence of malignant cells. In clinical chemistry, we are able to analyze chemical components of body fluids such as glucose, hormones, enzymes, and proteins, what their role is in their body, and their role in pathological conditions. We also test other body fluids such as urine and cerebrospinal fluid. In immunohematology, we learn how the immune system works, as well as learning how to identify and confirm patient and donor blood types for blood transfusions. A new field rapidly growing right now is molecular testing. Here you're able to test for patients' genetic conditions or identify pathological agents of disease such as COVID-19 right now, other examples such as Ebola virus, Zika virus, and others. What currently motivates me being a professor in the program is the ability to guide and inspire the new generation of medical laboratory scientists. Although our profession is not as recognized as many others in the field, our work constitutes how a patient will be treated. As many as 90% of physician decisions are based on laboratory test results. Therefore, our main duty is to provide quality and accurate results. I would like to share some pearls for success if you are interested in applying in the Clinical Laboratory Science program. The program itself will prepare you for certification and employment as medical laboratory scientists. It can also serve as an excellent undergraduate option for those students planning on applying to graduate programs, such as physician assistant program, medical or dental school, and now the doctorate degree in clinical laboratory science. Successful students tend to have a 3.0 or higher GPA in science courses. They usually complete about 14 hours or more per semester. They have the dedication and determination to achieve and excel in the program's rigorous courses, and the student should be able or have the ability to multitask and maintain composure under pressure. The program is 15 months, with the first 9 months being the didactic courses where the student learns the theories and techniques to function in a clinical laboratory. The last 6 months include clinical rotations where we are affiliated with many hospitals here throughout the Rio Grande Valley. There is where the student will apply their knowledge and skills gained on campus and didactic courses to actual patient care situations. When the student graduates, they will be able to sit for the certification exam through the American Society of Clinical Pathology. So how do we work with other healthcare professionals? The medical laboratory science graduates are part of the healthcare team and play a vital role in the prevention, diagnosis, and treatment of disease through the performance of laboratory tests in the laboratory. We are in constant communication with nurses and doctors in regards to the status of the patient, and we can give input on necessary laboratory testing that could aid in their diagnosis. We can also provide recommendations on additional testing that should be ordered on a patient, and we could explain and interpret results for doctors. At the moment, our profession is actively growing with several doctoral level programs in clinical laboratory science in the United States. Our goal is to be part of the diagnostic management team and be in charge of interpreting laboratory results and providing recommendations. That way, the physician or nurses are given accurate and reliable results. That way, they can just focus on positive patient outcomes and, of course, decrease healthcare costs. I would like to thank you for listening, and if you have any questions in regards to the Clinical Laboratory Science program, you can always visit the UTRGV website and find us there. Thank you very much.